1. Chemotherapy targets both cancerous and healthy, rapidly dividing cells. True or false? Answer: true. Rationale: chemotherapy affects all rapidly dividing cells, including cancerous cells and normal cells like those in the gastrointestinal tract, hair follicles, and bone marrow. This nonspecific action causes side effects such as nausea, hair loss, and immunosuppression. 2. Breast cancer is the most common cancer in men. True or false? Answer: false. Rationale: breast cancer is rare in men, accounting for less than 1% of cases. The most common cancer in men is prostate cancer, followed by lung and colorectal cancers. 3. Smoking is a major risk factor for lung cancer. True or false? Answer: true. Rationale: smoking, particularly cigarette smoking, is the leading cause of lung cancer, responsible for approximately 85% of cases due to exposure to carcinogens like tar and nicotine. 4. Mammograms are recommended annually for women starting at age 30. True or false? Answer: false. Rationale: current guidelines, e.g., American Cancer Society, recommend annual mammograms starting at age 40 for women at average risk, with earlier screening for high-risk individuals based on family history or genetic factors. 5. Tumor markers, such as CEA, are definitive for diagnosing colorectal cancer. True or false? Answer: false. Rationale: tumor markers like carcinoembryonic antigen, CEA, are not definitive for diagnosis, but are used to monitor treatment response or detect recurrence. Diagnosis requires imaging, biopsy, and histopathological confirmation. 6. Radiation therapy can cause skin erythema as a side effect. True or false? Answer: true. Rationale: radiation therapy damages rapidly dividing skin cells, leading to erythema, dryness, or desquamation in the treated area, requiring nursing interventions like gentle skin care and moisturizers. 7. Tumor lysis syndrome is an oncologic emergency caused by rapid tumor cell death. True or false? Answer: true. Rationale: tumor lysis syndrome occurs when chemotherapy causes rapid tumor cell death, releasing intracellular contents, e.g., potassium, phosphate, into the bloodstream, leading to hyperkalemia, hyperphosphatemia, and renal failure. 8. Neutropenic fever requires immediate antibiotic administration. True or false? Answer: true. Rationale: neutropenic fever is a life-threatening oncologic emergency due to low neutrophil counts, increasing infection risk. Prompt antibiotic administration is critical to prevent sepsis. 9. Alopecia from chemotherapy is always permanent. True or false? Answer: false. Rationale: alopecia from chemotherapy is typically temporary, with hair regrowth occurring 3 to 6 months after treatment ends, as chemotherapy targets rapidly dividing hair follicle cells, which recover post-treatment. 10. Palliative care focuses only on pain management for cancer patients. True or false? Answer: false. Rationale: palliative care addresses physical symptoms, e.g., pain, nausea, as well as psychosocial, emotional, and spiritual needs, improving quality of life for cancer patients at any stage, not just end of life. 11. Leukemia is a cancer of the blood-forming tissues. True or false? Answer: true. Rationale: leukemia originates in bone marrow, affecting blood-forming tissues and leading to abnormal production of white blood cells, which impairs immune function and causes symptoms like fatigue and infections. 12. Human papillomavirus, HPV, vaccination can prevent cervical cancer. True or false? Answer: true. Rationale: HPV vaccination protects against high-risk HPV strains, e.g., HPV 16, HPV 18, that cause most cervical cancers, significantly reducing risk when administered before exposure. 13. A PSA test is used to screen for breast cancer. True or false? Answer: false. Rationale: prostate-specific antigen, PSA, testing screens for prostate cancer in men, not breast cancer. Breast cancer screening involves mammograms, clinical breast exams, and self-exams. 14. Biopsies are always performed surgically. True or false? Answer: false. Rationale: biopsies can be performed surgically, e.g., excisional biopsy, or non-surgically, e.g., fine needle aspiration, core needle biopsy, depending on the tumor's location and characteristics. 15. Immunotherapy enhances the body's immune system to fight cancer. True or false? Answer: true. Rationale: immunotherapy, such as checkpoint inhibitors or CAR T-cell therapy, stimulates the immune system to recognize and attack cancer cells, offering targeted treatment for cancers like melanoma and lymphoma. 16. Spinal cord compression is a common complication of prostate cancer. True or false? Answer: true. Rationale: prostate cancer often metastasizes to bones, including the spine, where tumor growth can compress the spinal cord, causing pain, weakness, or paralysis, requiring urgent intervention. 17. Mucositis is a side effect of radiation therapy to the head and neck. True or false? Answer: true. Rationale: radiation to the head and neck damages mucosal cells, causing mucositis, painful inflammation, and ulceration, which requires nursing care like oral rinses and pain management. 18. All cancers are caused by genetic mutations. True or false? Answer: true. Rationale: cancer results from genetic mutations that disrupt cell growth and division, whether inherited, e.g., BRCA mutations, or acquired, e.g., from UV radiation or smoking. 19. Sunscreen use can reduce the risk of melanoma. True or false? Answer: true. Rationale: sunscreen protects against ultraviolet, UV, radiation, a major risk factor for melanoma, reducing skin damage and the likelihood of developing this aggressive skin cancer. 20. Colonoscopy is recommended every 5 years for colorectal cancer screening in average-risk individuals. True or false? Answer: false. Rationale: for average-risk individuals, colonoscopy is recommended every 10 years starting at age 45 per American Cancer Society guidelines, with shorter intervals for high-risk patients or abnormal findings. 21. Hypercalcemia is an oncologic emergency associated with multiple myeloma. True or false? Answer: true. Rationale: multiple myeloma causes bone destruction, releasing calcium into the bloodstream, leading to hypercalcemia, which can cause confusion, weakness, and renal failure, requiring urgent treatment. 22. Chemotherapy can be safely administered to pregnant women in the first trimester. True or false? Answer: false. Rationale: chemotherapy in the first trimester poses a high risk of fetal harm due to organogenesis and is typically avoided unless the mother's life is at immediate risk, with safer administration considered in later trimesters. 23. Lymphedema is a potential complication of breast cancer surgery. True or false? Answer: true. Rationale: breast cancer surgery, especially axillary lymph node dissection, can disrupt lymphatic drainage, leading to lymphedema, swelling, in the affected arm, requiring compression and physical therapy. 24. Tumor markers are always elevated in early-stage cancers. True or false? Answer: false. Rationale: tumor markers, e.g., CA-125, PSA, may not be elevated in early-stage cancers due to low tumor burden, limiting their use for early detection but supporting monitoring in advanced stages. 25. Hospice care is only for patients with a prognosis of less than 1 month. True or false? Answer: false. Rationale: hospice care is for patients with a prognosis of 6 months or less, focusing on comfort and quality of life, and can be extended if the patient's condition remains terminal. 26. Lung cancer is primarily caused by alcohol consumption. True or false? Answer: false. Rationale: lung cancer is primarily caused by smoking, environmental exposures, e.g., radon, asbestos, and genetic factors, not alcohol, which is more associated with liver and esophageal cancers. 27. Bone marrow suppression is a common side effect of chemotherapy. True or false? Answer: true. Rationale: chemotherapy targets rapidly dividing cells, including bone marrow, leading to suppression and causing anemia, neutropenia, and thrombocytopenia, requiring careful monitoring. 28. A low-fiber diet is recommended for patients with colorectal cancer. True or false? Answer: false. Rationale: a high-fiber diet is recommended to reduce colorectal cancer risk and support bowel health, except in cases of obstruction or specific treatment-related needs. 29. BRCA1 and BRCA2 mutations increase the risk of ovarian cancer. True or false? Answer: true. Rationale: BRCA1 and BRCA2 gene mutations impair DNA repair, significantly increasing the risk of ovarian and breast cancers, often prompting preventive measures like prophylactic surgery. 30. Pain management in palliative care always requires opioid use. True or false? Answer: false. Rationale: pain management in palliative care may involve opioids, but non-opioid medications, e.g., NSAIDs, adjuvant therapies, e.g., antidepressants, and non-pharmacological interventions, e.g., massage, are also used based on patient needs. 31. Pancreatic cancer is often diagnosed at an early stage due to clear symptoms. True or false? Answer: false. Rationale: pancreatic cancer is often diagnosed at a late stage because early symptoms, e.g., vague abdominal pain, weight loss, are nonspecific, leading to delayed detection and poor prognosis. 32. Radiation therapy can be used to shrink tumors before surgery. True or false? Answer: true. Rationale: neoadjuvant radiation therapy is used to shrink tumors, improving surgical resectability in cancers like rectal or esophageal cancer, reducing tumor size and local spread. 33. Neutropenia increases the risk of infection in cancer patients. True or false? Answer: true. Rationale: neutropenia, a low neutrophil count often caused by chemotherapy, impairs the immune response, increasing infection risk and requiring precautions like hand hygiene and isolation. 34. All lymphomas are classified as Hodgkin lymphoma. True or false? Answer: false. Rationale: lymphomas are divided into Hodgkin lymphoma and non-Hodgkin lymphoma, with distinct characteristics, e.g., Reed-Sternberg cells in Hodgkin lymphoma and treatment approaches. 35. Therapeutic communication avoids discussing cancer prognosis with patients. True or false? Answer: false. Rationale: therapeutic communication involves honest, empathetic discussions about prognosis, tailored to the patient's readiness, to support coping and decision-making in oncology care. 36. Testicular cancer has a high cure rate when detected early. True or false? Answer: true. Rationale: testicular cancer, particularly seminomas, has a cure rate exceeding 95% when detected early due to effective treatments like surgery, radiation, and chemotherapy. 37. Cachexia in cancer patients is caused solely by reduced food intake. True or false? Answer: false. Rationale: cachexia results from a combination of reduced food intake and metabolic changes driven by tumor-induced inflammation and cytokine release, leading to muscle wasting and weight loss. 38. A sentinel lymph node biopsy is used in melanoma staging. True or false? Answer: true. Rationale: sentinel lymph node biopsy identifies the first lymph node draining a melanoma, aiding in staging and determining whether cancer has spread, guiding treatment decisions. 39. Chemotherapy can cause peripheral neuropathy as a side effect. True or false? Answer: true. Rationale: certain chemotherapy drugs, e.g., vincristine, cisplatin, damage peripheral nerves, causing neuropathy symptoms like tingling, numbness, or pain, requiring dose adjustments or supportive care. 40. Superior vena cava syndrome is an oncologic emergency caused by lung cancer. True or false? Answer: true. Rationale: superior vena cava syndrome, often caused by lung cancer or lymphoma, results from compression of the superior vena cava, leading to facial swelling, dyspnea, and requiring urgent intervention.